term children, where the mother is malnourished, that descent does not take place at the 9th month.
Okay.
So then there is a existing defect, and the content of the abdomen can pass through into the scrotum. That is what is called congenital.
What are the contents of the abdomen? What is in the abdomen?
Bowel is there, omentum, we have the large bowel, we have small bowel. Any of them can move through this defect into outside the abdomen.
Okay. So you talked about the congenital hernia, now you're talking about the other one?
We are talking about the acquired.
Acquired. How do you acquire hernia?
Okay.
This doesn't sound like something you want to acquire.
No. It's a common surgical condition since man started walking on 2 legs. You know, there's a breed that we were working on 4, and then eventually we started walking on the 2 legs. And that is where actually the hernia is the most common surgical condition all over the world. Now, we spoke about the canal through which the testes descend into the scrotum. As we grow, the tissues become weak, and then activities like anything that will increase intra-abdominal pressure is a risk.
Like lifting a weight?
Like lifting a weight. If you have a disease that increases the pressure, if you strain at urinating, if you strain at passing stool, that's constipation. Yes. Lifting heavy weight, and then manual workers, farmers, including farmers. So they commonly develop. It can also occur in all other populations, but they are at a higher risk because the activities and their daily work involve increasing intra-abdominal pressure. Now, all
can women get hernias?
Yes.
They can?
Yes.
Okay.
The women can get.
They don't have testes?
But they have the pubis majora.
Okay.
And there's a ligament. We have the testes there, but there's a ligament, and that ligament passes through, and then there's also a defect there.
Okay.
So women can develop hernia. Women can develop what is also known as femoral hernia. You know, they have a wide pelvis, and at a younger age, they have a lot of fat. That as they grow older, the fat shrinks, that space become wider, and they can develop also femoral hernia. It can also occur in males.
Okay. Well, how does it present? How do you know somebody has a hernia?
Okay, so you yourself will notice it. So, for example, when you wake up and you are standing up in bed, you could see a bulge, and then the bulge disappears.
How big can that bulge be? What's the biggest hernia you have seen?
Like my head.
What?
That's what we call wheelbarrow hernia.
Wheelbarrow hernia?
Yes.
And it's down there?
It's down there in the testes.
Lord, is it not painful?
It's painful. It's not defect. That's what we call reducible hernia.
Wow.
So it comes out. There are small ones which is limited to the groin. It's a bulge, you see it and it disappears. Okay? But the ones that are permanent into the scrotum, some will be permanently there. It cannot go back.
And you have people walking around with these hernias for a long time?
Yes.
For like how long?
The one we saw in Ho, which was the biggest, the man was wearing for about 10 years.
A 10-year hernia?
10-year hernia.
How did it impact his life?
You are not able to work. You are not able to function very well.
Wow.
And
did you help him?
We
removed it?
Yeah, we removed it.
How long was that procedure?
About 1.5 hours.
Wow.
So you see, there are many big hernias. People are working with it. Some are afraid to treat it.
Why?
Some have also ideas that traditional treatment, but a tradition you can't treat it because what is inside is a content. It may be a bowel. So how is the traditional medicine going to treat it?
It's an organ that you need.
Yes. Is it going to dissolve it? How are you going to do it? So the only treatment is surgery.
Okay. So the person presents with the hernia to you, you examine the person, and then take us through the steps.
Okay. So the person presents to you, you take a history You examine the patient, the complaint history, examine the patient, and then confirm the diagnosis. Mostly in Ghana, the diagnosis is clinical. In other places, they do other investigations.
When you say it's a clinical diagnosis, what does that mean?
Clinical means that you take history, you examine, and then you conclude.
Okay.
That is based on the clinical information.
Okay.
Yes.
All right. And then, so you conclude, and then how do you treat that?
By surgery. So all that you do is the content, you return it back
to its original location.
To original location.
Okay.
And then the defect, you repair the defect. In the olden days, we used to use the patient's own tissue to repair it.
Where would you take the tissue from?
The same place.
Okay. The groin area.
Yes, the groin area.
Okay.
There is a ligament, there is a fascia that you use to repair it, patient's own tissue.
Okay.
But there is a modern technology, because if you repair with the patient's own tissue, it's likely it's going to come back because the tissues are weak.
Yeah.
So since 1990, there is a prosthesis that is used called mesh.
Okay.
So now the common use method is the mesh repair.
Okay. Is that available in Ghana?
It's available in Ghana.
Okay.
Before it was difficult, but through the effort of Ghana Hernia Society.
Okay.
Ghana Hernia Society is a society formed by a group of surgeons from University for Development Studies, and then University of Ghana, and then University of Ghana, that's Kwalebu Teaching Hospital, and then Komfanoche Teaching Hospital, Kwame Nkrumah University of Science and Technology. So we came up and realized that the hernia is so common. There was a study.
So common, right?
So common.
How many hernias do you see in a month? A week?
Now I'm purely administration, but before you can see about 5-6 in a day.
In a day?
Yes. Professor Ohene
Yeboah
published a paper in 2012, and it says, by estimation, in 10 years' time, which is 2022, there's going to be a backlog of 1 million hernias in Ghana unrepaired. If we continue to do what we see in the clinic and try to repair it, there's going to be backlog.
A million?
So, 1 million.
How many surgeons like you exist in Ghana now who can deal with hernias?
I don't know the exact number, but there are few. That is why we came out with a strategy, because before or now, experts from outside Ghana come to some of our district hospital in attempt to solve the problem. But we realize that they cannot solve the problem. It's an African problem, and that we should have our own way of solving it. So that gave birth to Ghana Hernia Society. And then from there, we're trying to find out how we can solve it. And I told you that 10 years, 2022,
backlog.
That is 1 million. Now we are in 2025. That's, if we calculate it, it's about 100,000 new hernias developing every year. So now we are in 2025, so it is no longer 1 million, it's about 1.3 or 1.5 million. So that is why we came together as a team to say that if we limit the repair to surgeons, the surgeons are mostly in the cities, in Tamale, Kumasi, Accra, Cape Coast. So these are where the teaching hospitals are, and this is where the surgeons are trained. So if we continue to do that, there's going to be hernia pandemic.
So what's the solution?
So the solution we came up with is that go outside, go to the district hospitals, train doctors who are not surgeons, give them the skills so that they will be able to repair hernias.
How's that going? How many have you trained so far?
We did a study in Ho. First of all, you need to demonstrate whether they can equally and effectively treat the hernias as surgeons. So what we did was that we went to then Ho Regional Hospital, now Ho Teaching Hospital, and then the surgeons and then the medical officers who are not surgeons were trained. We give them the skills, the didactic lectures, everything, and then we give them hernias to repair. What we wanted to do in that study is to demonstrate that if you train the medical officers who are mostly working in the district to repair hernias, they will have the same results.
Definitely so.
So we did that, and then we followed the patients up to 1 year, and we realized that in terms of quality of life of patients, in terms of complications, in terms of everything, there's no difference between the two groups. Successful.
Good.
Because to train a surgeon after medical school 6 years, you need a minimum of 3 years to train a surgeon to repair the hernia. So can we do it faster to say that this is only what you are going to do? So we did that. It was very successful. We collaborated with Ghana Health Service, University of Ghana, University for Development Studies, and then KNUST. And it was so successful. Now we try to expand it. Now how are we expanding it? So now we're going to go to the district, because this is where the patients are.
Yeah.
These are farmers, either they are farming or they are fishermen. So we're going to go to all this district hospital, go to a district, bring all the doctors to train them to solve the problem, instead of relying on people coming 1 week to come and repair Ghanaian hernias.
It's a remarkable piece of work you're doing with your team.
Yes.
I must say congratulations.
Thank you.
Before we go, can you tell our viewers what preventive measures they can take? Can you prevent hernias?
Yes, because now you see, I explained to you about intra-abdominal pressure.
Yeah.
But we've also realized that recently, footballers, they do a lot of exercise. And they don't develop hernias commonly than our population. So there is a theory coming up to say that there could be some form of underlying malnutrition that gets the tissues weaker.
And more susceptible to a hernia.
More susceptible to hernia. Again, we have conditions. If you have constipation, you have to treat it. You have to drink a lot of water. You have to eat vegetables.
So that pushing out is dangerous?
It's dangerous. Okay, and then we have people who have also got prostate problems, and because they strain when they are urinating, it increases the abdominal pressure. Again, not all people develop hernia.
Yes.
So that brings us to the fact that there could be some underlying abnormalities in the muscles, in the musculature, that lead to the hernia. And that is ongoing to find out what is missing. Is it some amino acids? Is it some collagens that are defective based on diet?
Right. So the research is ongoing?
The research is ongoing to confirm that.
It's been a stimulating conversation, Professor Tebere.
Thank you.
I'd like you to tell our viewers something that they must remember, something that they should not forget as far as hernias are concerned.
Okay.
The camera is over there.
There's perception among men, and that's why people carry hernia for a long time. People believe that if you repair hernia, you will not be able to give birth. That is completely false. It is not true. Now, the other thing is, please, if you have a hernia, don't be afraid. Please go to the doctor for it to be repaired. The danger is that if you don't do that, and the hernia gets stuck, and then pressure increases, and the blood pressure is blocked, it means that part of the tissue or structure that is in the hernia will die, and you need a major surgery that you have to stay in the hospital for weeks. And that also carried a lot of complications. So once you develop it, once you see a bulge in the groin that appears